All right, welcome back. Now, the recent spate of gender-based violence cases that have hit the headlines in recent days has brought the conversation around how the issue is being handled. Despite policies and strategies in place to address SGBV cases in the country, the progress has been too slow. Well, this is due to some institutional gaps as well as general fear of victims to report abuse. Now, according to the Kenya Demographic and Health Survey, more than half of them did not report. So what can be done to reverse the trend? Well, joining me in studio to unpack all this are Faith Odhiambo, Law Society of Kenya Vice President, and Alberta Wambua, Executive Director of the Gender Violence Recovery Center. Ladies, thank you so much for coming in. Alberta, let me begin with you. You actually interact with victims directly. When you look at the number of cases that we're seeing, of course, as a media, we can report them as isolated cases, but you've seen the trends. Are you seeing a spike and an increase in cases recently?
Thank you, Victoria, and thank you for having me. Yes, there is an increase in reporting of cases, and that's gender-based violence cases. Yeah. And as you rightfully said earlier, there are many more cases that are not reported for different reasons. So yes, the spike also has a pattern. Yeah. For example, around the festive season, we have higher number of cases around humanitarian settings. So for example, around the COVID-19, around the electoral period, we usually have a higher number of survivors. Again, when there's insecurity, you just showed earlier, for example, in Nyamira, and the ladies who houses were being broken into and the girls were being raped. So those then are the patterns.
So what kinds of cases, injuries do you see coming into the center, for instance?
So there are different forms of gender-based violence, and about now 54% of the cases will be sexual violence survivors, followed by 33% of intimate partner violence. And then we have other forms of violence. So for example, harmful practices like child marriages, female genital mutilation, neglect of children, the psychological abuse, there's economic abuse. So those would be the other forms of abuse. But most of the forms of violence that we see are sexual violence. But of course, then we also have 9 hospitals or 9 gender violence recovery centers spread across different counties, and that also prevent very differently. So it's also important to say, for example, our Ongata Rongai branch would present with more intimate violence, partner violence survivors, would have Nairobi, Hurlingham, Adams having more sexual violence survivors. So it's also very different, the different regions.
Faith, let me come to you, because by the time a victim musters up the courage to report, many times they do not know how to navigate the system. Their first port of call usually is the police station. What should ideally happen there when they report?
So in an ideal system, we expect that there are gender desks and that police should be able to take in information, record their statements, and guide them in terms of they need to fill a P3 form, and also, just gather proper evidence to help support mounting a proper prosecution against the violence that has occurred. But the challenge that we have in this system that we have is that even if you look at most police stations, unless the ones that are supported by most CSOs, you see there are no actual gender desks. And even training on how to handle and collect evidence, and most importantly, just how you treat the victim, because it takes so much to even get to that place. But even how they treat the victim, asking such, demeaning questions, and also asking for evidence. And sometimes perpetrators are even close family relatives. So how to collect that evidence or bring witnesses to come and show that this person violated me. So instead of just that guidance, and also when we think about the number of the doctors that are there, in terms of, there's always this one police doctor who appears to give evidence in the Kenyan system. In fact, there was one, when he died, people were asking themselves who is going to be the next one. There needs to be a bit more in terms of just guiding and supporting the victim, even from that police station. And more so now, the justice system that is even more tedious. Because how do you report a victim in a case scenario where you're in a family setting and no one will be accepting, and they expect that maybe you forgive and let's, it's shameful, let's sweep this under the carpet. Who takes care of the victims?
Right.
And, we have the Children's Act and we have the Witness Protection Act. But the challenge is, in actual sense, you have a situation, especially if it's a child or a young girl that has been violated, and the mother refuses to report or refuses to accept. Where do you take that child? The rescue centers that are there are very few, and even that element of response on that sort of support that they're giving to such rescue centers. FIDA Kenya had to adopt one of young girls who was abused in Mombasa because the mother refused to accept. They wanted to sweep the matter under. So FIDA literally adopted this girl, and she's in a rescue center. She's undergoing, counseling. But even that element, till the school that this girl is going to, they also need that support in terms of accepting or understanding what is this child going through. And the challenge also that we have is there are no rescue centers that are also taking families. In terms of the baby Sagini case, also when investigations were done, the sister had also been violated. So there was a scenario that they couldn't get a home where to put. Sagini had to go to hospital, but even thereafter, and because the mother was refusing to take, and take care of the children because she's saying she has to work, who is going to stay the whole day and watch over them? You have the daughter, where are we going to, you separate these two victims. They have already gone through a lot of harrowing experience. There are no centers to put these children. How do we take care of them post this experience? Right.
And we'll talk more about getting deeper into the legal system, once they report it and whatnot. But let me come to you, Alberta, because Faith mentioned something really critical when it comes to this GBV ecosystem, if you will, and that's rescue centers or safe houses. When you look at the general map of the country, how are we faring when it comes to that?
So currently we have about 62 shelters. And shelters is one of the actions under the Generational Equality Forum commitment. So it's one of the things that's being done. So how that's being addressed is under the Gender-Based Violence Sector Working Group that I chair at the National State of Gender and Affirmative Action. So this one mapped. The need was really needed. The services were really needed around the COVID period. So we came up, there were 62 MAP shelters. Now there are gaps because in those, the very few state-run. In fact, I only know of about one that's even a county run, that's in Makueni County. So there's a Shelter Networks Forum that's now forming, standard operating procedures, getting proper registrations for the same, because it does not mean that they're safe places. GVRC, for example, is about to set up 13 shelters across the country. So there are people who are coming up and trying to set that. Polycare has a form of shelter. So Polycare is the police centers. There's one at the traffic police station and Laikipia. So I know they're setting up Polycare stations, and that also provides temporary shelter. And then working on the referral mechanism so that then it's functional, being able to, refer the client from one state to another. So shelter is a need because, one, when you look at the medical treatment, psychosocial support, it's not a one-off service. It's something that would span where I work for about 6 months for medical treatment if it's an outpatient, and with severe injuries even way longer for psychosocial support, an average of about 1 year. So as Faith says, you have to keep this client and the family, for example, protected. There is the Witness Protection Agency that also came through when baby Sagni was there. So there are mechanisms to be able to protect, but they're still not at 100% or ideal.
What would you say needs to be done to strengthen those mechanisms?
So one, resources. Putting the resources for gender-based violence response, having health facilities that are all able to provide, the up-to-standard medical treatment and psychosocial support. There are clinical guidelines that are at a national level, updated as late as last year. There are different case management protocols that are in place. So again, enhancing those capacities of different service providers, and not just the health service providers, the police, the teachers, the school programs. So then there's also protection and response. Again, so enhancing the capacities of service providers, providing the services. Again, also creating awareness in the communities and sensitizing them, because then there's a lot of, would I say, discrimination and stigma. Yeah. Just the death of Starlet, you could see how people were blaming her, you know, and things like that. So we also have a lot of victim blaming. And apart from that, also a lot of bystanders. So we are seeing all this violence is happening, but we're just watching, you know, and not taking action and things like that. So there's a lot of work to be done, right from socialization, even in our homes.
Oh, certainly, and it's unfortunate because had it not been for the death of Starlet, we probably wouldn't have seen the other victims come out to see this kind of trend, you know, of that individual. But let me come to you, Faith, and if we can get the graphic of the P3 form up, because some people don't even know what that looks like, you know, when reporting a case to the police. Many complaints you get from police officers is, look, they'll come to report and down the road would drop the case. How do we actually see these cases through to their conclusion legally, Faith?
What we've tried to do is we have a toll-free line, and I'm also a member of FIDA, and they also have a toll-free line for reporting, and we try and support in terms of that entire process, giving pro bono legal services that we've always ordinarily done. But the challenge happens is the collection of evidence. I think that's the greatest problem. There was a time during the former Director of Public Prosecution, Tobiko Keriako, had asked female lawyers who are specially trained to handle GBV cases and SGBV cases to come up, and he gazetted special prosecutors to also support that entire process. I know the former DPP has also tried to train special gender-based violence prosecutors to try and also, you know, sift through the evidence and try to come up with a tight case. But the problem happens is, how do you secure these witnesses even through that entire process? Because to ensure that you pay these witnesses to come to court, some don't want to come to court, or they can be intercepted at some particular time and compromise that, you know, it's already happened, so why can't we pay you a settlement? And, you know, and if the witness refuses to come and testify and refuses to come to court, you cannot hold your case. So there is need for support from the inception of that entire system, of that ecosystem, from the time the victim comes to report. How is that evidence processed? Are the police also well-versed in what procedures should be followed, how to guide this victim? You need to get this, you need to get this. Which referral hospital can they refer them to get proper the report, the medical report done, and then they come to them, and then how does the prosecutor take this matter up and handle it? Do they need witness protection? Is this somebody who is in need of taking them to a shelter or special home? And what are the guiding support that is offered from that process until the time it's presented to court? And even ensuring these victims continue to come to court, or the witnesses come to court. We currently don't have a system whereby that there's a kitty you can also, you know, because poverty, the reality is most of these cases, the victims of the witnesses that have to come to court are from quite poor backgrounds. So there's nothing to even financially support them to keep coming to court, because ideally our court system also, we are not, it's quite tedious and it takes such a long process. So imagine reliving harrowing experience every single time. And because we have a justice system that believes in right to fair trial, and the accused person must face their accuser, then you have to keep coming to court each and every time. And so you're like, it's so expensive to get justice. The things that we need also to consider and see, how can we expedite certain cases? Because as much as we have enough laws, we have the Sexual Offences Act, we have the Penal Code, we have the Witness Protection Act, Protection Against Domestic Violence, so many laws are there, but what legal system has been set in place? We have seen the judiciary has gazetted special SGBV courts, but they're in Mombasa. And if you know some of the highly prevalent places apart from Kilifi and Mombasa, there's still Kisumu. You've mentioned Makueni, there's Homa Bay, amongst others. So will you, if I want access to justice that is expert, do I go to Mombasa to have my matter heard? So as much as the judiciary has started that process, I think what you actually mentioned in terms of resource is quite important, and the Office of the Director of Public Prosecution needs to invest and support in that, and NCAJ also supporting the witness protection scheme, and also ensuring these witnesses are able to come to court, irrespective that poverty should not be the reason that you cannot get access to justice. And when she mentioned resources, it reminds me that we have the President, His Excellency Dr. William Ruto, mentioned that these are part of his imperatives, that he wants to ensure and protect rights of women, rights of girls. And he has a special advisor on women's rights and the CS on gender and gender affairs. She's also set in place, but what investments has been set aside to deal with this menace that we're having in Kenya? What kitty has been given to the advice on women's rights to be able to handle? If we look at just in November, we are celebrating the 16 days of activism, and the theme was the investment that the government is giving. So after the 16 days of activism that even the Law Society participated in, what have we seen? I'm yet to see how much now they are saying they'll put in, how much are they supporting even the NCAJ. I know FIDA Kenya chairs on sexual rights and gender-based rights. They are the chair of that NCAJ committee. But how much has the government invested in? Because it's been highlighted that currently it's only one shelter that even the government is actually running. So if government is serious about investing in stopping and stemming this menace that is troubling the nation, why can't they actually put their money and invest in it? Because we need investment in shelters, but we also need investment in that justice system. And the government is part and parcel of NCAJ. We have the IG sits at the NCAJ. What kind of investment is being placed in his office in terms of the policemen, even at least how much are they putting in the gender desk? How much are they putting in the shelters? How much is the Office of the Director of Public Prosecution putting in place to ensure that he's able to handle the collection of evidence in terms of guiding the police, and they're able to preserve and ensure these witnesses can come to court and that they can support them from start to finish, that this matter is hard and determined? Because the reality is, unless most cases, even like Baby Sagini's case amongst others, unless you have organizations like the Law Society of Kenya or Federation of Women Lawyers joining those cases, they end up being bundled. And things, you hear along the roadside that things went wrong or the victims refused to come to court, but you'll find it small nicks here and there of frustration that the victims find that, it seems that I can't get justice in this country.
So certainly some stuff has been done, but it needs to be scaled from what I'm hearing from both of you, and resourced as well. Let's put up those hotlines, the police hotlines up as well, in terms of access that victims can get help from an immediate standpoint and hopefully make their way to a police station for more help. But that ecosystem needs to be strengthened, absolutely, from the conversation that we've had here tonight. Thank you so much to Faith and to Alberta for your insights. That's all the time that we have. Let's take a short break here on Citizen Weekend. Much more ahead. Stay with us.